30,000 independent pediatricians in the U.S. share a frustrating daily reality. For every 8 hours they spend seeing patients, they spend over 2 hours staring at a screen, typing out clinical notes. The industry calls this physician burnout. Pediatricians call it pajama time. It is the hours between when their own kids go to sleep and when they finally close their laptops, charting medical records instead of being present with their families. The toll of this late-night documentation goes beyond exhaustion. 1 in 3 pediatricians report severe burnout. At the exact same time, the average practice loses over $125,000 annually to billing errors and miscoded notes caused by rushed, incomplete charting. The current standard of care forces a choice nobody should have to make. Pediatricians must either sacrifice their connection with patients to type during the exam, bankrupt their practice with coding errors, or give up their own evenings to clear the midnight backlog. The tech industry's answer to this is a flood of general-purpose AI medical scribes. But these tools were built for medicine broadly, and they often struggle with the specific demands of the pediatric exam room. When you deploy a horizontal AI model into a pediatric environment, its clinical blind spots become obvious. Generic scribes consistently fail to track developmental milestones, and they stumble over specialty pathologies like Tanner stages or hand-foot-mouth disease. During complex sick visits, they frequently miss what clinicians call pertinent negatives in the review of systems. If a doctor notes no cough and no respiratory distress, standard AI often omits that negative finding, a critical failure for both legal and clinical accuracy. These tools also struggle with the actual audio of a pediatric visit. Because they aren't trained on family dynamics, generic AI models often confuse a parent's anxious reporting with the physical symptoms of the child. Adopting a generic AI scribe in a pediatric clinic creates a new administrative chore. Instead of saving time, physicians find themselves manually proofreading and correcting specialty-specific clinical errors. Dr. Danae Nelson, a practicing pediatrician, experienced this exact burnout. Rather than waiting for a solution, she co-founded ExamNote AI to directly solve her own clinic's crisis. Built directly on Google Cloud's Gemini infrastructure, this ambient capture system is exclusively trained on pediatric vocabularies and multi-system encounters. It listens in real time, automatically distinguishing between parental concerns and patient findings. Before the physician even leaves the room, the engine generates a highly structured SOAP note. It natively tracks developmental milestones and surfaces accurate pediatric billing codes directly from the conversation. Because the architecture is pediatric first, the output requires virtually no editing. The doctor secures a clinically accurate, fully coded chart during the visit, completely cutting off pajama time at the source. Eliminating the late-night charting only solves half the problem. The second massive drain on practice resources is post-visit parental anxiety, which leads to hours of unbillable follow-up calls and endless portal messages. ExamNote AI addresses this directly through its proprietary patient-facing companion app, ParentBridge. The moment the appointment ends, the AI translates the complex clinical SOAP note into a 6th-grade reading-level summary. It strips away medical jargon, giving parents a clear list of what was checked, what was found, and specific follow-up instructions. ParentBridge turns clinical documentation into a direct patient engagement tool. It completely neutralizes parental anxiety before they even leave the parking lot and effectively eliminates hours of unbillable callback labor. Applying ambient listening in a pediatric setting carries strict ethical and legal barriers. The inherent risk of recording children in medical environments demands absolute data security. This chart explains ExamNote AI's zero-retention stateless architecture. Instead of holding audio data to train models, it captures audio into a serverless node, converts speech to text, and vaporizes the original audio buffer without ever writing to a storage drive. This guarantee means zero protected health information is retained. It provides verifiable HIPAA compliance, giving physicians the absolute proof they need to explicitly gain both parental consent and administrative sign-off. Most enterprise AI medical scribes are priced at over $500 a month, locking out independent clinics. ExamNote AI sets that cost at $149 per provider per month. That pricing is possible because of the stateless Google Cloud infrastructure. It only consumes computing power when patients are actually being seen, keeping overhead incredibly lean. It also deploys with zero friction. Operating purely through a browser-based copy-paste workflow, a practice can be live in under 30 minutes, completely bypassing complex EHR integrations and IT department delays. ExamNote AI bypasses the multi-year enterprise procurement cycle entirely. It is immediately deployable technology built specifically for the independent practices that need it most. When that seamlessly integrated technology enters the exam room, the daily reality of the hard-working pediatric provider fundamentally shifts. Across a standard 5-physician practice, the staff instantly regains over 10 hours of collective time every single week. The goal of advanced AI in healthcare shouldn't be to replace the physician. The goal is to make the technology completely invisible. Solving the documentation crisis allows pediatricians to finally end pajama time. It gives them the freedom to reclaim their evenings, look their young patients in the eye,